there's a stepladder approach on practicing flexible endoscopic intubation. The first step is the lab. So we could practice on animal lab or dry lab. Most commonly, we practice on mannequins. The second step is to practice on a sleep patient with normal airways. After that, when you master that, then you proceed to practicing on patients that are awake but still have normal airway. After that, that's the time you perform flexible endoscopic intubation on patients that are awake with difficult airway. A lot of us doesn't want to practice on mannequins because it's different from an actual patient. That is true. However, it is also true that practicing with a mannequin gives us the dexterity and muscle memory to perform better when we're performing flexible endoscopic intubation on an actual patient. Also, what I do is I get a sponge, insert it on the mannequin's airway, then it will serve like a tumor. So every time I place it, it's in a different place. So I still get the So for example, for this one, the airway is here. I will go here. Okay. So this creates variety even though I'm just using one mannequin, because a lot of us, I know that mannequin already. So I don't want to practice on that mannequin anymore. I've memorized it already. But with this, it gives you some variety. It gives you additional challenge. When I decided to learn flexible endoscopy, there were flexible scopes available. However, mannequins that are good in bronchoscopy are not that easy to find. So, I decided to create my own bronchoscopy trainer. So, I made paper mache to simulate the path of the airway and I painted it orange. Okay. And at the end of each segment, I place some photos to make it more entertaining. Okay? My point is, if you really want to do something, you could overcome any obstacle. After practicing on the lab, you could proceed on practicing on patients that are asleep with normal airway. The good thing is, one, the patients that are asleep, if something happens, you could just convert from flexible to other devices or techniques such as visual laryngoscopy. After practicing on patients that are asleep with normal airways, you can now practice on patients that are awake with normal airways. So here you could practice your topicalization, anesthesia on the patient. However, this is the challenging part on convincing a patient with normal airway to perform flexible and awake intubation. So sometimes we recommend for a resident to pair up so you could perform flexible endoscopy on each other. The nice thing about this is you could feel what your patient is feeling when you perform flexible endoscopy. Or you could practice on your own. After you have mastered these first 3 steps, now you could proceed on performing awake, flexible endoscopic intubation on patients with abnormal airway.